Welcome in. It is a familiar call from Governor Laura Kelly this afternoon.
For a sixth time, she's calling for the expansion of Medicaid. She made that announcement this afternoon with this message to lawmakers.
I'd like to remind those in the legislature, your colleagues did not elect you. Your constituents did. And I implore you to start taking positions that reflect their wants.
Kansas is one of 10 states that have not expanded Medicaid after the Affordable Care Act gave states the option to do so. 90% of the funding comes from the federal level. The state pays the other 10%. Governor Laura Kelly spoke at the William Newton Hospital in Winfield after others also voiced their support for expansion. Jacob Albrock joins us with the latest push.
Rachel, since Governor Kelly was elected, lawmakers have not come close to expanding Medicaid in the state. In 2017, they were close. It passed both the House and Senate, but got vetoed by then Governor Sam Brownback. Governor Kelly says that if Medicaid is expanded, about 150,000 more Kansans would be eligible for health care. She also pointed to surveys from Fort Hays State that show about 72% of voters say they support expanding Medicaid. She gave an example of a single mom of two only qualifies for CanCare if her annual income is at or below $9,500. If she works 30 hours a week at minimum wage, she does not qualify in Kansas. The head of William Newton Hospital also spoke about the impact of not expanding Medicaid and it's having on rural hospitals.
The biggest impact for rural hospitals like William Newton are the cost of uncompensated care. And annually, the cost of our uncompensated care is roughly $2.5 million. Let me make this abundantly clear, though. Even though we are not receiving reimbursement for that care, uncompensated care is not free. It costs all of us.
The governor also says she's traveling around the state this fall to call for Medicaid expansion. She's calling it her Healthy Workers, Healthy Economy Tour. Kansas Republican Senator Larry Allen was also at the announcement this afternoon. He tells us that he believes the governor's priorities should be on something else.
Right now, I think the real thing is, in people's mind anyway, when you go to the door, when you go talk in town halls, it's not Medicaid expansion. It's taxes. It's property taxes, it's income taxes, taxes on Social Security. That's the number one issue to people in Kansas.
Senator Allen says a lot of things have to be worked out before Medicaid expansion moves through, including the reimbursement rates that hospitals receive. Expanding Medicaid would unlock an estimated billions of dollars in annual federal aid to the